You'll have an arm, you'll have a little IV case, got everything you need in it, so you don't have to memorize everything you need. It'll all be right there. But just remember, when you do this competency, giving IV fluids is giving medication. All right, it's considered medication, so you got to do all those rights of med administration that you do on your IV med competency. You're going to have orders, you're going to have an MAR, just like you did in there, an MAR. Check your orders to your MAR, make sure it's correct. But do tell them you would verify the solution 3 times. Something similar to normal saline at 100 milliliters per hour. All right, and you're going to have to take that and convert it to drops per minute. That's going to be your drug problem. So you go to the milliliters per hour and you multiply that times your drop factor, and where's that?
On your tubing.
Okay, and divided by 60 minutes in an hour. That's all you got to remember. Milliliters per hour times the drop factor over 60. It's going to give you drops per minute. You'll be able to use a calculator. The only time students usually mess up on that equation is if, and I think I took them all out, but if the order were to say 1,000 milliliters of normal saline at 100 milliliters per hour, you still go to that milliliters per hour. The 1,000 milliliters just tells you what size bag to hang, but the rate is what you've got to convert to drops per minute. All right. So once you've done that, you compare your orders to your MAR. Then you can just use your MAR just like you did in the other thing. We're going to get everything ready before we go in our patient's room, but you ain't going anywhere but here, or you are not going anywhere but here. All right, and you right here, right now, we're pretending it's the med room, and in a minute it'll be the patient's room. So we're going to make sure we have the correct fluid that's ordered. Obviously, it won't have our patient's name on it that we can check, but you want to make sure I have normal saline. That's what's ordered. What else do I have to check?
Date.
Expiration date. Don't be surprised when you get in your competency if your fluid is expired, because we get donated fluids all the time to help us not have to buy them all. But usually it's in one of the 4 corners. If it is expired, you can just say, this says it expires in 2012, but I'm going to pretend it's not expired. They know. I mean, they're completely aware. Also, it should be clear. It shouldn't be pink. It shouldn't be yellow. It doesn't have anything in it, so it shouldn't be any color. The only time you'll really see fluids that are different colors is if they have meds in them. Shouldn't have anything floating in it. You're going to put that into my vein. I don't want little pieces of something in there. All right. So that's what you're going to check for on that. So we're sure that's all good. You can go ahead and spike the bag, take your tubing. When you open IV tubing, first thing you need to do is close it. Roll the clamp down. Open the tubing, roll the clamp down. The reason being, especially in a competency when you're nervous, if you forget to roll the clamp down and you spike the bag with this, you're going to get air from here all the way to here, bubbles, pieces of air. You won't fail, but you got to spend the whole time, you have to spend 10 minutes trying to get all the air out before you can actually go and start your IVs. Just like you did with putting syringes and needles together, this can't touch anywhere. This is all dirty and this is going in my vein, so just be careful. And then if you will push and turn at the same time, put it all the way down to there's a little notch there. Squeeze it. You can squeeze it, if you squeeze it all the way hard, you can squeeze it one time and it'll fill up about 1/3 of the way, and that's good for this competency. You've got to count drops before you leave there, so you need to be able to see the drops. But you can't just, it can't be down to here, because then you're going to get air. So it needs to be 1/3 to 1/2 of the way full. Then over the garbage can, or the sink, but we don't have any sinks in here. So you would open this up, leave the cap on the end. It should prime around it. You should be able to let the fluids go around it. If you can't, you can loosen it up a little bit, but don't take it off, because then you've got to, first of all, you got to make sure this doesn't get contaminated, and second of all, if it does get contaminated, you got to walk around with this in your hand the rest of the time, because you can't put it down, because this will get contaminated. So just leave it on over the garbage. If you will do it slow, you can watch it kind of come down the tube, and you won't lose. I'm going to do it really slow because I don't want it to go. As it passes each one of these, just see that go? if all of your ports, will thump them, yeah, and then you would let it go, and I don't have a garbage can here, but that's okay, I'm done. You would let it go till all the little air bubbles that you had thumped out go into the garbage, or the sink, or whatever. And so once this is done, it's ready to go to our patient's room, so we're good. You need a start kit. We're gonna start our IV as an INT line, and then hook initiate our fluids. So you will need an INT port. Now, in your competency, you will have these pre-filled flushes. To practice in your bag, you don't have them. So what do you need to do is get one of the syringes out of your bag and make you a flush with saline. So you'll need one of these, and you'll need a catheter to start. There'll be gloves and alcohol pads and all that out if you need any of that. All right, so first thing we're gonna do though, before we get to the patient's room, is we're gonna flush our INT line. We don't want that hooked up to my arm with air in it, right? All right, so I am going to, carefully, and I don't want to shoot any of y'all. I'm holding on to this where it's not going to get contaminated, but this is going to have air. You need to get all that air out, okay, first. All right, then we're going to open this up. Leave this cap on. You don't need to take it off. All right, this just pushes and turns. All right, hold it upside down. You just want to put enough through till it comes out the end a little bit like that. You can leave that hooked up. Go ahead and clamp that off, but this can go to the room with you just like this. We are not trying to see if it works, we're just trying to get the air out. One of the reasons we do this in the nurse's station, if you have time, if it's not an emergency, is because when you start handling needles and IV lines and stuff, it makes people nervous and they get scared. And when they get scared, they hold their arm like this, and it's harder to stick when they're all tensed up, all right? So we're ready to go to our patient's room. We've got our fluid, our INT line is ready to go, and we've got everything else we need. So now, this is magically changed into my patient's room. You will identify your patient like you're giving medication, because that's what you're doing with IV fluids, okay? So name and date of birth, armband, and have them tell you. There are not armbands on these, you just need to verbalize that to them. You will ask them about allergies, and you'll explain to them what you're doing, all right? And so once you've done that, you need to do hand hygiene. You'll just use the alcohol foam, or if it's that stuff right there, use that. So we're in the room, and we've done all the telling our patient, meeting and introducing ourselves and identifying them and all that. So gonna go ahead and open, because I need to pick a vein and get the arm clean. I'm gonna open my kit. You'll have your prep is right here. If you're the first one that day, there may already be a tourniquet under the arm, but if not, it's in there. So first we're just gonna pick which one we're gonna do. All right, so you're gonna put the tourniquet on, put it on tight enough that you're occluding the vein, but you don't need it to be turning blue while you're looking for try to get these to go at the end of the arm, because if they flop this way after you've cleaned onto your clean area, you've got to clean it again, all right? We're gonna pick our vein by choice. So you're just gonna pick in a real person, whichever one feels the fullest, the spongiest. So once you've picked it, you can pop that while you clean it. Now, the ones in your kits in your bag are just the little ampule, and you have to break it yourself. This is the same thing, it's just in a safety thing, so you squeeze it together and it pops it on its own and soaks this thing. So it's ChloraPrep, so remember when I did meds, with alcohol you go in a circle, but with ChloraPrep you do a basket weave, right? All right, now you want to clean a big enough area that you're certain you're going to stick where you've cleaned, but I can't clean the whole forearm just to be safe, so just clean your area. You're supposed to do it for about 30 seconds. All right, it's back and forth, all right, so you've done that. Then while that's drying, we can get everything ready. So it's first thing I'm gonna tell you to do, or first thing you need to do is loosen this, because when you get ready to hook that to your IV, you're only gonna have one hand. And if you are, when you first take that loose, you'll see that it's on there pretty good. So we're gonna do that. Notice I don't have gloves on because I don't need them on yet. You only need gloves on once you stick. All right, so I'm gonna go ahead and open this. Now, the size and gauge of your needle is on here, and you're gonna need that when you chart. So if you don't know what it is, hold on to this piece of paper. You can chart later. All right, once you've got this ready, your site is clean, and think you're ready to go. Oh. The other thing, transparent dressing. Again, you're only gonna have one hand because you can't let it go until you get the dressing on it. So if you will just fold that down, I did not peel it apart and expose any of this. This got to be sterile when it goes down on my site. Just bend it like that. That way you have a little handle to pick it up, and it's just easier to pull apart. All right, I'm gonna put my tourniquet back on. I'm gonna put my gloves on if I had any. All right, first, there is one thing students do, actually, first, and I know why, but is they get this on and it's clean and they're getting ready to start. They want to touch it again and make sure it's still there. It's still there. Don't touch it. You've cleaned it, right? You can't do that. Even if you have gloves on, you can't touch it again. So you're going to displace the skin, and you can do that however is comfortable for you. Some people come, this is sticky. Some people come from here and stick over their thumb. That's fine if you want to do that. No problem. Just don't let it touch your thumb when you're sticking. Some people do it from the side. Lots of nurses will hold it from underneath. That's two purposes. Then you can't jerk your arm out when I'm trying to stick you as well. But you can't hold these from underneath. So you're either going to have to go over your thumb, or you're going to have to do from the side. Now, if you do from the side, don't put your hand up where you can't see where you're sticking and you're over your clean side, okay? Just kind of put it down. I'm going to displace the skin. Now, let's talk about sticking before I do it. The catheters that we use, if the button's on the top, the bevel is up. But you need to know that you always stick with the bevel up, okay? When you're practicing, do not push the button, because then the needle goes into this little thing and there's no way to get it out. That's why you have about 4 in your bag, because you're going to push the button sometime. But when you're practicing, you can stick and take this colored part and slide it down and just sit this to the side, and then that way you can just put it back on and reuse it. All right, in your competency, and I'm going to do it, you'll push the button, all right, because you want it to retract and be safe. Okay, we're going to stick it about a 20-25 degree angle. You will feel the vein pop in these arms, and once you do, don't stick the needle any farther, because if you do, just like on a real person, you keep on advancing the needle, you blow the back of the vein out and you have to stick them again. So you'll about 20-25 degrees, you'll feel it pop. When you do that, don't push the needle, lower it down, take the colored part, slide it into the arm all the way to the hub, okay? All right, so I'm gonna retract the skin. I'm going to go at about a 25 degree angle. If you shake and accidentally touch the skin, you need to re-clean and get a new needle. Even though it was all sterile, you can't pick it up and then touch again, okay? All right, I felt it pop. I'll lower it. Now, you should get blood return back right here. However, when you're practicing, these arms, they use them to practice piggyback push. Y'all use them to practice starting IVs and hooking fluids up. So all of this is clear, and you can't see it in your, see, I have it. I have a little bubble of clear, but y'all are not going to be able to see it. So if you don't get blood return, don't get all upset in here. We'll figure it out, okay? All right, so I've lowered it. I'm going to go ahead and pop my tourniquet because that doesn't need to stay on. I'm going to advance this all the way to the skin. I'm going to go ahead and get this ready. Maybe. There we go. Okay. Now, all right, see, even though I have let that go, this is still in there, so I'm okay, because I'm going to hold this. I'm going to pop this, flip it around. If it bleeds a little, that's okay. A real person's going to, all right? Now, you want that on there as good, you know, as tight as you can get it. Now, at this point, I'm going to unclamp my syringe, and I'm going to flush this with 1 to 2, or about 1 really. And I am looking for swelling at the end of my site. If they, you know, oh, that hurts, it shouldn't hurt. It's just saline, it's just into the vein, so it shouldn't, it may sting right at the beginning, but they shouldn't be, you know, like it hurts. And there should be no swelling at the end. If there is, then you're not in the vein anymore. You would, you know, you've either blown out the back or whatever. You would take it out and re-stick. But, so I'm going to flush, and I'm good. So I'm going to change hands told you have your little handle there, pull it off. That part goes up to the top. You want to completely cover up the colored part of your catheter, but don't cover up where it connects. All right, so then pinch it together around your catheter and then put your hand down on the rest of it. And once that's on, you can let it go. All right, I go ahead and take this off. That can go in the sharps container. Now, as you peel this off, because these are not real skin, this does not stick to it as well. So as you peel it off, follow it with your finger, otherwise it's going to rip off your dressing off your arm. And it's not your fault, it's just the way the equipment does on plastic. Then pinch it again and make sure, and you can take a piece of tape now and make your J-loop, or you can do it after you hook your fluids up. That's up to you. I'm gonna get this started. If you're gonna do it before, all you're gonna do is make a loop and put your tape over it so that your patient doesn't pull it out in the bed. There's at least something, trying to help it. Now, don't put any paper or tape over this transparent dressing, all right, because you need to be able to see your site to assess it every time. All right, once that's in, we've checked placement by flushing it. We've taped it and secured it with the dressing. We can hook our fluids up. All right. I'm going to clean the end of this with alcohol because I don't know what all it touched. Well, actually, I'm going to take this off first. And then clean this with alcohol. Again, you just push and turn till it's hooked up. All right. This is the worst. This is what messes students up. And that's setting this the drops per minute. All right, so if we did our problem 100 times 10 drops per minute divided by 60, and let's say we got 32 drops per minute, and I don't know if that's what you'll get or not, but you got 32 drops per minute. You are gonna put your watch up here, and using this, count drops like you count pulse, all right? 1. All right, so can you put your watch down here? Because every time you look down, you miss a drop. You're gonna have to hold it up here. And so here's how it will work. I'm gonna count drops for a minute. Say I get 60. Then I'm going to slow it down, and I'm going to count drops for a minute, and I get 48, and I'm going to slow it down, and I'm going to count drops for a minute, and I get 28, and I'm going to speed it up. Do you see how long that's going to take? All right, so take your drug problem, divide it by 4, right? A minute divided by 4 is 15 seconds. So whatever you get divided by 4, you get that in 15 seconds. Then once you've got that correct, you count it for a full minute and make sure you have it right, okay? The only reason we do that is to speed up the process. Now, I wish you weren't taping me, but I'm going to say this anyway. I am 99.99999% sure you will never have to count drops, right? I had to do it twice, and that was because I was doing home hospice. Most hospitals won't let you give. I mean, you can, or they'll have the little dial tubing, so you can just put the dial on what it's, even if it's not on a pump. So, however, you do need to know how to do it just in case. All right, so we would start this up. However you think 32 drops, 8 drops in 15 seconds looks, and you would count them for 15 seconds and then speed it up or back, whatever you have to do. We get 8 drops in 15 seconds. We count for a full minute to make sure we have 32. And once that's done, you're finished. We have started our IV fluids, and so to chart that, you would put 22 gauge 1 inch IV catheter initiated to left forearm, blood return noted, flushed with 1 milliliter of normal saline without swelling or complaining of pain at the site, and then normal saline initiated at 32 drops per minute. All right, so you got to chart what size catheter you use, what site you use, that you got blood return before you flushed it, that you flushed it to make sure the site was good, and then the fluids you started and how fast they're going, or what their rate was. All right, so the next day the doctor comes in and says, oh, I almost forgot. In your start kit, there's usually a label, or in this case it was on the edge of my dressing, that you need to label the site, and you just fill in the blanks, your initials, the date, and the gauge. That way the person that's DCing it will know how long the catheter is supposed to be. So you would fill that in and put that somewhere on your site. Again, not anywhere on top of your transparent dressing though. And if this person's gonna be in the hospital, you know, if you put it over here, you may wanna cover it with some tape, because as they bathe and whatever, it's just gonna fade and fall off, even though it's gonna be changed every, 3 days or however long they do it. All right, so we're gonna change this to, doctor says stop the fluid but leave the I&T line in. So you come in, you need to put gloves on because you're gonna be flushing this site into an I&T line, and anytime you fool with an I&T line, we wear gloves because there's a chance that blood could back up and get on you. So all you need is a flush. I'm gonna use the same one, and it's been contaminated, but you would not use one that's been contaminated. So, all right. So we're gonna come in, identify your client, explain to them what we're gonna do, wash your hand, or do hand hygiene. I'm gonna stop my fluids, taking note of how many milliliters are left in my bag. It's an estimate. I mean, you don't have to drain this and do it. I'm looking at this and it's almost full, so about 220 milliliters. Once your fluids are stopped, you're gonna undo your fluids from your arm. You're gonna assess your site. If it's cold and hard to the touch, what's probably happened? It's probably infiltrated, right? The IV's not any good anymore. If it's hot to the touch or red, it's probably infected. Either one of those scenarios, you can't use this site anymore, so just DC it, and you just start another site as an I&T line. This site looks good, but I'm still gonna go ahead and flush it just to make, even though I had fluid going, I'm just gonna make sure. What if she just knocked it loose? So you're gonna clean that with alcohol. I'm gonna make sure you have the air out. You're gonna hook this up without contaminating it, and you're gonna flush it just like you did when you put it in. 1 to 2 milliliters, looking for swelling, or complaints of, pretty significant pain. I don't have any, so this is good. Last thing you need to do is make sure you clamp this off, all right? Clamping it off is what keeps it from clotting off between when I'm fooling with it and when a nurse comes to give medicine, or when the next nurse comes to flush it, or whatever they're gonna do. If you leave it unclamped, chances are it's gonna clot off, which means they're gonna have to be stuck again. Charting that. Normal saline DC'd with approximately 220 milliliters left in the bag. IV site without swelling, coolness, heat, redness to site. Flush with 2 milliliters normal saline with no swelling at site. And of course, how you left the patient and how they tolerated it. I'm not gonna go through all that. And then lastly, you'll have to take it out. So you'll need gloves, of course. You're gonna need either a 2x2, cotton ball. For this, you'll have these little 2x2s. They come in your start kit so that you could anchor the site sometimes. Whatever you're gonna put over it after you take it out. Put your gloves on. Go ahead and get all this tape off from all of it. Now, you want to take the tape off of this. You don't want to try to pull it all off at the same time. You've got gloves on, so it's hard, but if you'll hold this and lift it up a little, you can hook your finger under that. I'm just trying to tell you how to do it with these IV arms. Pull all that off. Then before you pull it out, you want to cover the site with whatever you're using, alcohol prep or whatever it is. I mean, not alcohol prep, but cotton ball or this dressing before you pull it out. Because if you pull it out and it flicks a little bit, it could get in your eye if you don't wear glasses or whatever. So straight out, immediately apply pressure. What am I looking for? If it's broken, does it look like it's supposed to be an inch? Does it, and this does. Is it frayed at the end? Does it look like it's got a piece missing? If it does, that's an emergency, right? So tourniquet goes on the arm and you call for help. Don't leave your patient. You got to get an x-ray. They show up on x-ray, so hopefully it's still in the arm and they can go get it out. Most nurses don't walk around with tourniquets in their pockets unless they're going to start an IV. So if you don't have one, find something. Blood pressure cuff, pump it up. Usually, even now, they still have them on the wall sometimes. But find something to use as a tourniquet. This goes in the sharps container, and you hold pressure until it quits bleeding. How long is that? I don't know, until it quits bleeding. If you take Coumadin, you may stand here 5-7 minutes before it stops bleeding. if you're, you know, if my son is your patient who's 25 and healthy, you may stand there 15 seconds and it'll quit bleeding. And then put whatever kind of Band-Aid or tape your cotton ball down or whatever you're gonna do. This, hold your arm like that till it quits bleeding, is not okay. All right, because if they put their arm down after you leave the room and they get a big old hematoma, who's gonna get in trouble? The patient? Mm-mm. So, that, you know, just hold pressure till it quits bleeding. And that's it. Then you would just chart that 22 gauge, 1 inch, and you'll know that from the label that's on there, right? That was on the arm. If the label's gone, you can find it in the nurse's charting from the day she started it, okay? 22 gauge, 1 inch needle DC'd from left forearm, catheter intact, site without signs or symptoms of infection or without heat or redness, pressure held until bleeding stopped. And that's it.